I'm Michael Sanders. I'm a professor of public policy and director of experimental government here at King's College London, and I'm an associate of the Centre for Homelessness Impact. So, Staying Put is a program which the government has run for just over a decade at this point, which allows young people leaving care, so when they turn 18, to remain living with their foster carers for up to 2 years after they left care, rather than experiencing what we would call a care cliff, where all of their support falls away when they reach 18. Yeah, so this is essentially a relationship between the local authority, the foster carers, and the young people. Everybody has to want it to happen, and there are financial supports available for the foster carers to continue to look after the young adults now after they leave care, and as well as a number of other changes which reflect their ability to continue to foster other young people when they've got this young adult living in the house. So one of the big features of it is paying foster carers, because foster caring pays. It's an occupation as well as a vocation, and so making funding available for that is a large part of it, as well as the legal changes. So we conducted an evaluation that looked over all of the data so far about the effects of staying put. And what we did was we compared those local authorities that have high levels of take up with those with relatively low levels of take up, as well as comparing within local authorities over time. So waxes and wanes within an individual authority. What we find is a pretty large, statistically significant reduction in the risk that young people leaving care experience homelessness in those years when they're eligible to stay put. So, for example, what we see is if you were to increase the level of take up of staying put by 13% across the country, that would prevent about one person within each local authority each year from becoming homeless. That translates to just over 300 across the country each year being prevented from experiencing homelessness. So there are a few recommendations that come out of it. For local government, obviously one of the things we're very keen to see is higher levels of take up of staying put. We also need to recognise that there are different tiers of local authorities that are dealing with homelessness often compared to those that are dealing with children's social care. And so greater communication between those tiers of government is really important to facilitate interventions that exist in one area but support outcomes in another area. At national level, what we're recommending is further guidance and support for staying put, but most importantly, we're looking for further increases in the funding available for staying put arrangements, because this is a program that costs money and local authorities don't have very much of it. National government has done a good job in increasing gradually the funding that's available over time, but what I'd really love to see is a step change in that funding.